Hi, my name is Amy Whaley, and my son is John Michael Whaley. He's 26 years old, and he suffers from NPC 1. John began having noticeable symptoms early in life that were misdiagnosed. He began having cataplexy at age 13, and by 16 had a massive grand mal seizure at school, and that began his rapid decline and a 3-year search for a diagnosis. John is currently being treated with multiple seizure medications, antidepressants to try and help his thought process. He's taking a first trial agent, which he's been having continuously since 2011, and is receiving a second trial agent in Chicago at Rush University Medical Center. Once started on the first trial agent, John's seizures greatly improved and his decline was noticeably slower but still continued. In the summer of 2017, we were able to start infusions of the second trial agent. I'd been watching the trial for a few years, waiting to see how the children were tolerating it, assessing to see if it was something that we were willing to try with John. And we heard about the positive results and spoke with some other parents whose children had been receiving the drug. My husband and I decided to talk to John Michael about possibly receiving it. John has difficulty with comprehension, communication, expressing himself, and getting his thoughts out. But when I explained the infusion, what he would have to go through to receive it, but the possible positive things that could happen, I asked if he'd be willing to try. His response, clear as day, was, "I'd be a fool not to try." The results, especially in the beginning, were amazing. We saw the light come back in his eyes, his voice came back, his expression, his ability to communicate. His gait even improved, and he was able to eat some foods he hadn't tasted for years. After his treatment the first time, he was wide awake and full of energy. He was upbeat and happy. He called my father that night and said, "Hello, Grandpa." My father gasped, and I could hear him crying. He hadn't heard John's voice for years. One of the greatest downsides to treatment for John is the process he has to go through to receive the infusion, and the fact that it isn't a cure and he continues to decline despite of it. We travel from Michigan to Chicago every 2 weeks. It takes 2 days of travel and treatment in which John misses out on daily life. He misses school, activities, time with his friends, physical occupational therapy every other week. Instead of being up and active, John is stuck in a car for 12 hours. The day after treatment is a full day of rest. Day 1 post-treatment, John can barely keep his eyes open, he's quiet, he sleeps for most of the day, and he cannot stay awake to eat safely. Fortunately, John had a G-tube placed in 2013, and we've been able to use that to keep up with his nutrition and hydration. By Sunday, he perks up a little, and by Monday, he's back to school. By the time he's really doing well again, it's time for another treatment. In an ideal treatment for John, I hope for less invasive approaches to treat NPC. I hope for a shorter treatment process that requires less travel and shorter recuperation times. I hope researchers are able to find a way to reverse more of the symptoms and to ultimately halt the progression of the disease. When considering new treatments for John, I always look at the whole picture. What is best for John, and ultimately, what is the safest for him? I consider infection risks, possible complications from treatment, and hospitalization time. I look at possible side effects and the quality of his life. I want John to live his life with joy and happiness. I want him to be filled with laughter and independence. And ultimately, I want to minimize hospital time so John can enjoy his life for as long as he is able. I look at my son's life and the lives of all of our Niemann-Pick children, and I am filled with both hope and the feeling of overwhelming heartache. Our children are suffering, and they are dying. For so long, all I felt was hopelessness, sadness, and fear from watching my son disappear before my eyes and knowing that one day he will not be here. But today I am filled with gratitude and hope as I am able to ask for urgent attention to be brought upon NPC. We need more treatments and a cure desperately for our children.